Thank you so much for joining in and welcome to this episode of the EY GCC Leadership Series. Today we are here at Bengaluru at the Novo Nordisk Center and we will be talking to John about their journey. Thank you, John, for speaking to us today. Let me start with this center, right? So you've got a large number of functions, global functions. You've got a lot that's happening on the clinical side as well. Mm-hmm. And you've been in India for some time as well. So you've gotten an experience of what's happening in this space. What do you see from your point of view in terms of the market today, especially the GCC market and also the healthcare space? Let's talk a little bit about the maturity that you see in India.
Yeah, thank you. And thank you very much for the opportunity to talk about this. You know, it's I'm here in India about a year and a half now. But our GCC is in its 17th year.
Wow.
But it's been a rather slow burn, if I'm honest, compared to some of the other builds that you might have seen over the last couple of years. We started, like most others, as shared services, IT, finance, actually legal and patents being a kind of starting point for us. Then, as we've seen the growth, we're now almost 4,000 people, and we're across about 14 functions. So every executive vice president, every board member's area has some representation here, right from early research and development through to R&D, through to supply chain, IT, commercial operations, and finance, etc.
And do you see a lot of sponsorship coming from the executive board?
Yeah, I mean, it's particularly been driven, the growth through Denmark-based SVPs, really, first of all, honestly, seeing the opportunity in India, but scaling it very slowly. Right. So the starting point being, okay, let's see if we can bring in, you know, in our pharma world, older products, life cycle management work that's a bit less sexy than what was going on in Copenhagen. Right. Let's start with that. Let's see whether India can cope with that. Wow, they can cope with it. Oh, by the way, they can also hire people who are skilled. And then the growth has gone through each SVP function. And that's particularly prevalent in our development organization, where you would see some full global accountability now here in Bangalore for activities that either don't exist in Copenhagen or anywhere else in the world, or alternatively, the ownership and the leadership of those activities are based here in Bangalore. And there are teams here, there are teams in US, there are teams in Denmark that are led by...
And has that worked out well?
Yeah, I mean, it's a journey, and like any organization, we're probably doing it in small steps, but it's working well. I think the leadership competencies are something that we've worked on quite a lot over the last couple of years, because, you know, these kind of global leaders, they've got to understand not only how to lead folk here in India, but also how to lead Americans on a different time zone, Europeans, and so on and so forth. And so there's cross-cultural leadership, there's cross-country leadership, there's also cross-functional leadership here, which is also key when as we continue to scale.
And that's interesting, because what you've just told me is a pretty successful blueprint of how a GCC should evolve, in the sense, obviously having the right teams here, having the right sponsorship, having the right kind of leadership being developed here. Now, you said about 14 years, right, in the country? Or?
No. It's 14 years in the company, but about a year and a half here in India. So,
in India. Yeah. And the center itself?
It's about 17 years.
17 years, right? In that 17 years, John, obviously the market in India from a talent perspective has also gone through a significant change. Yeah. Anything that you noticed today, ever since you've arrived in India, in terms of how the talent itself in India is shaping up? Yeah,
I mean, you know, we're a bit unique, I guess, Novo Nordisk, being a Danish-based company. You know, the total population of Denmark is 5 million people, half the size of Bangalore. So if you're growing as a company and you need to hire, pharma skilled people, Well, hiring 100 medical doctors in Copenhagen is really hard. Yeah, yet here we know that there's 100,000 medical doctors coming out of Indian universities every year. So we've certainly found that the availability of skill, the availability of talent, the prevalence of that talent, and I would say also that the flexibility of mindset of folk that we're hiring is as good, if not better, than anywhere else in the world. We also see, we've taken some small steps into closer collaborations with academia, with universities. And some rather unique things, at least in my experience, are where the university academia, the professors, are super keen on understanding our needs as an industry, to the extent where several would want to come here and spend a bit of time working within our organization so that they can then train the skills of the students in a better way. And I'm not sure I see that elsewhere in where that I've worked.
And exactly that. When we talk today to academia, I think one of the things, one of the regrets they have is while there's a lot happening on the GCC space, there's not enough co-creation happening for the future, right? So when we talk to academia, they would like to see the likes of Novo, for example, co-creating curriculum so that the folks that are graduating are better prepared and far easily employable, let's say, and don't require a significant ramp-up time when they join companies, right? And that's the purpose. And I'm very glad to hear, and I think also for our listeners, this is amazing that you are already in that area, right? And we want to see a lot more happening in that space. Let me now pivot maybe a little bit towards technology, and that's a big play in the center here from what I hear. Any specific examples, John, on how you are probably driving innovation using technology, specifically in the areas that Novo operates?
We set up a couple of years ago an innovation garage here. So a number of people who we've hired as specialty folk to understand the startup ecosystem and to be able to sort of work with our leaders here, understand the use cases, the problem statements, the difficulties that they have, and then go out into the startup and tech community to try to figure out whether there are opportunities. And there's a couple that spring to mind. First one being something around utilization of AI in clinical study reports. So instead of a medical doctor or a medical writer be authoring every single word of that and taking them weeks to do, now we can utilize that with some very good Gen AI tools. Second, probably a bit more interesting, is in our clinical reporting organization. This is the people that first author, then review documents which leave here and they go to the regulatory authorities all around the world, US FDA, Japanese PMDA, etc. And the quality review of those documents, for one rather large, multi-page, 100-page document, that quality review can take 40 hours for one document. Yeah. The Innovation Garage folk found a startup here in Bangalore that had done some proof of concept work in financial services of automating that quality review. So for one document, now we've gone from 40 hours to about 40 minutes.
Wow. And that has reduced also the number of people doing that.
No, well, it's not reduced that. In fact, what happens is that we've proved that so well here in Bangalore that now more of that work is coming from Denmark into Bangalore. And we've not actually reduced the team size. We'll be expanding.
But you are driving a higher throughput through that team because of the enablement.
Yeah, okay, so it's a really interesting model. And actually, we think that utilizing the same software, we're now looking elsewhere in Novo Nordisk, in other verticals, could use the same stuff.
Right.
Also, there's a big appetite elsewhere in the world for utilizing that in things like contract management review, for example, and amongst others. So, yeah.
Interesting. And I'm presuming, based on what you said, John, you are equally excited about AI and generative AI as the rest of the world is, right?
Yeah, I mean, we're super curious. I think, I don't know whether it's the grey hairs or whether it's the pharma company conservatism. We always get a bit paranoid about the quality of the output. But there's a lot of sandbox work going on here in this organization across almost all the functions to try and figure out how we operate with Gen AI. Yeah, for sure.
And maybe just one last point, John, you touched upon startups. Do you see GCCs at large and even Novo itself collaborating more heavily with the startup ecosystem here in the country? Because obviously that's another hot topic today.
I think we're pretty excited about it, yes. I mean, it's been baby steps with maybe 2 or 3 over the last couple of years. But there are so many opportunities to collaborate with startups here, not just in functional work and process optimization, but in other things like employee engagement, communications, internal comms. There are brilliant ideas from folk that are here in India and specifically here in Bangalore that we can tap into. So we've got to open our minds a bit and get away from the not invented here syndrome and realize that these collaborations can really make sense. Yeah.
Perfect. Well, I think your journey has been nothing short of exciting. We wish you all the best. So thank you, John, for speaking to us. We wish you all the best. And for those listening in, thank you so much for joining in. We will be back with the next episode in this series shortly. Thank you and take care.